Hi, and welcome back to Co-Parent Court, the court where parents forget the drama and work through the trauma. I am your host, Judge Rochelle Jackson, and I have in the studio with me for our last taping KJ Franklin. And KJ is our designated trauma specialist. So today we are going to finish up the series and we're going to again talk about childhood trauma and the impacts of that trauma, looking at co parenting, looking at maybe some treatment, and whatever else KJ wants to share with us as we try and figure out how we identify those traumas, how we assess those traumas, how we get treated, what some recommendations are, and more importantly, how do we make sure that as parents, we are conscious about our actions so that it will not have a negative impact as best we can on our children. So, with that, let me reintroduce KJ. So, welcome again, KJ.
Hi.
It's a great day.
Okay, so as we rehash childhood trauma, I'll do a little recap on what childhood trauma is. As we all know, or as we are learning, because this is an education storefront, we're not here again to diagnose. We're just here to educate individuals on childhood trauma and how it can affect your children, co-parenting styles, and adulthood and relationships. Childhood trauma can develop after experiencing a stressful situation, abusive of life, or even life-threatening event. These experiences encompass what has or has not happened to children, like parents failing to meet their needs. Trauma can manifest immediately or even decades later, and even as intergenerational trauma, which is sometimes called transgenerational trauma. Intergenerational trauma can be described as the impact of trauma or traumatic experiences, not only on one generation, but on subsequent generations after an event has happened. Intergenerational or transgenerational trauma is something that's not often talked about in a community, but it results in lasting impact on later generation.
All right, can I pause? Can you pause for a moment? And you, I think you did, and I'm not quite sure. Two types of intergenerational trauma. Did you give us two?
So intergeneration, they call it intergenerational trauma or transgenerational trauma. They use both terms. Although it's not commonly discussed, it is very common in the community, and occurs because it's a generational, they'd be like a generational curse. It's something that's repetitive and handed down over and over without actually being sought through, looked at and treated. Something similar to what we was discussing, like with the ACE scores and those questions. Some of those questions are normalized things for us, and we don't look at it as it being a trauma factor because that's how our family or heritage or individuals, has always taught or spoke to us. So we may have not looked at some of those questions as being traumatic event or traumatic occurrences to say, okay, I have experienced childhood trauma.
So, what's an example of what an intergenerational trauma that's not identified because it gets passed down?
Like anything, like not one thing, but something as simple as profanity in a family, like when families are, Black families or families of certain distance or whatever may, use the term, go sit your bleep down, or, clean something as simple as that over and over and over. Can be seen as a form of trauma or abuse because of the aggressive tone, and we don't realize that that can start instilling a sense of fear in an individual or a sense of, triggering effects in an individual, and then they until start to communicate in that way to their family or their children, and you are setting a tone of fear.
I don't know if we started this conversation like back in the first recording that we did, and I spoke about. I think I shared about when I go into stores and I see adults using profanity with children, and I'm thinking, stop. Like you don't have to
Mhm.
say it like that. But that's the trauma that you're inflicting on your child.
That's that intergenerational, yep, because you know it's gonna set a tone for them to do something. And then we have this new thing with gentle parenting. Individuals make fun of the gentle parenting, sector because, like, is that really gonna work with you gentle parenting with your kid? Because back in the day, when mama, grandma, whoever told us we better do whatever, it was done. And now this gentle parenting, they try to set this tone like you're encouraging your child to run over you in so many words, where a lot of people are acknowledging that some of those things we did back in the past, has set a tone of trauma and we want to parent differently.
Yeah, you can still be firm and set tones and boundaries without using profanity and
Yeah.
inflicting that, in my opinion, that type of language that your child then learns, right?
Yeah.
And they take it to school, and the teacher's trying to teach, and they're using profanity. And
Yeah.
we call the parent to try and figure out what a solution is, and that's how they're answering the phone and what they're going to do when little Johnny gets home, and you're thinking, how do at least in my classroom, can we start there? In the
Yeah.
home, it's generational. It's mom who's doing it and dad who's doing it, and we have a lot of work to do in the community to make sure that our effort here again is to educate. So at least recognize that it's not best.
It is that the kids are bringing that into the outer world. It's not just in the house, it's bringing it into the outer world. Because just like you was a former educator, I have a lot of close friends. My husband is an educator, and I get the same feedback when they call the parent, about discipline issues, as such as, verbiage or poor verbiage. The parents are responding by, "Oh, that's it. That's why you're calling," or, "Well, I'm not too worried about that because they could be doing something a lot worse," and not knowing that small little tidbits like that is how worse things kinda start to grow and develop. Also, adults with repressed childhood trauma, they bring certain behaviors and traits into relationships and marriages, certain as those heightened sense of hyper vigilance, anxiousness, clinginess, chronic worry, explosive anger, lack of communication, or always feeling tired, exhausted, or feeling sick, or depressed. And they don't realize that that repressed childhood trauma that they haven't really sought help for or recognized or identified is what's bringing those things into a relationship and marriage and what's causing a division amongst the household or division in a way that they may be raising kids or causing havoc on kids because they are having explosive anger tantrums or like very clingy, don't want to let mom or dad leave the house or are always assuming they're doing something negative when they do leave the house and want to do something, which can bring the dynamic of a relationship and trust and stuff down. And they may be a reason why some domestic occurrences begins to happen as well because of repressed childhood trauma.
So when you say repress, how does that look? Like how does a person
It's not identified as blocked. Yeah, it's blocked issues. Because some things has been normalized or transferred from generation to generation. It's looked at as normalcy. And or some individuals may be in denial when things are pointed out to them to identify, well, hey, maybe you should look at things from a different perspective, or that's not quite the way to do something, but because that's the way that they have seen family or generations before them do things or whatever, and it's normalized, they think it's the correct way, not realizing that they have put a block or hold on their childhood trauma, the fears that was in placed into them, the route of manifesting certain things or lack of positive reinforcement in them. And now they're triggered with and have these symptoms of anxiousness. I have these symptoms of clinginess or have these symptoms of explosive anger and not realizing that they're pouring that out on their mate, pouring that out on the children of their household, pouring that out on friends or even in the workforce, and how that's impacting the home, or how that may impact a division in the household, or how that may impact their method to be able to co-parent once that division occurs because they never saw the problem when it was in a relationship. So how is it a problem out of the relationship and that you're finding these problems? But it's because they have so many repressed childhood feelings and trauma and behaviors that they're not open to researching and identifying. And statistics show that more than six I'm sorry, go ahead. Statistics shows that more than 60% of children experience trauma before the age of 16 years old. So in adulthood, it's very common for them to develop those traits and symptoms of depression, anxiety, PTSD, and or addiction, which again is bringing a negative factor into a family environment, which again is bringing problems and repressed situations and domestic abuse situations or lack of communication or lack of a sense of connection into families.
I I started this the co-parenting court with the hope of educating parents and helping to resolve issues. Oftentimes when I speak to clients, and I work in the area of domestic violence, and trying to figure out how I help them navigate and to figure it out themselves for how does how do they create this new relationship so that their children get the benefit of both parents, right? And oftentimes when we do the intake and first meet the one of the parents, you get to hear all of their traumas. I can't diagnose what it is, but it's over and over again talking about things that happened to them in their childhood. And you can see the interactions about how they engage with their parents and how the other side perhaps had a different upbringing and their relationship with their parents are different. So you have this clashing because your way of rearing children doesn't agree with dad's way of rearing children. So now, how do you compromise and how do you create this new lane for you all to operate under so that your children get the benefit of having both parents actively engaged in their lives? And one of the biggest challenges is getting the clients to recognize their trauma, right? And their, I call them issues because, again, I'm not a doctor to diagnose anything, but we do offer referral services. So I quite often encourage them to get into seek therapy and counseling so that they can push through those issues that I recognize. And I'm like, unless you can push through it, at least identify for what it is, and then it's difficult to create a good co-parenting plan that will give your child the benefit, of having both parents actively participate in their lives.
And that's
But
the most important
the
thing.
unidentified repressed trauma, I think, is key, and in our community, um, it's challenging to, and I think we need to be honest about how we were raised, what we bring with us, what those good things are, and then how do we educate ourselves out of those uh, in unproductive situations, and in particular, and speaking about the trauma, like how do we identify it and what do we need? Where are the resources to help us navigate it?
Being able to identify being in judge sometimes for people release some of that pent up trauma, they may have to be forced, to take stock about, well, hey, let that little clock or let that little ticker start going in their head. Like, do I have that? Are these some symptoms that I've exhibit, because it's repressed because they don't know that they have it, or they never been exposed to anything different from what is their norm, which may be a traumatic event. So, encouraging mental health outlets, encouraging some of these tests, encouraging individuals just to be more knowledgeable and educated on certain things so they could take a look at the variants on how to deal with things, can kind of lead to individuals maybe finding out if that is the source of their issue. Of course, they gotta wanna be helped at some point, and they gotta get out of, the run factor that, "No, this is me, this is the only way to go because I was raised this way." But if they're really open to co-parenting, equally, or having better relationships across the board, they're gonna be interested in learning some facts about themselves. Of course, there's no single list, that can capture how children respond to their environments or even life events once you grow up. But there are plenty of therapeutic ways or whatever to kind of work through the trauma, to release that pent-up trauma, to relieve some mental health symptoms, even chronic pain, and issues, that individuals don't realize is a symptom of mental health issues. A lot of people go to the doctor all the time because my joints hurt or I'm having irritable bowel symptoms, not realizing that you have repressed childhood trauma. You have some type of repressed trauma or mental health issue that is going on inside of you. And, it's working outwardly as a chronic illness. Getting to that point or pinpointing, the issue and where it's stemming from is something that is needed. And again, our place here is to educate individuals so they can go out on their own to try to find the help that they need. There's
I'm going to do what's called, I think people call it a shameless plug, but no shame in this plug. And we are always looking for guests to come onto the show. Co-parentcourt.com is where you can make an inquiry, say you want to be a guest, you and the other parent, so that at least we can begin the dialogue and point you in the direction. Because the first thing it says is that you're willing to have a conversation about your co-parenting issue, and that you're open to receiving some guidance in terms of the next steps for you to create this relationship in this new lane. Now that your intimate relationship has ended, how does an effective co-parenting lane looks? We invite you, encourage you to send us a message at, being a guest on Co-Parent Court, and we'll be happy to try and provide some of that guidance and talk through some of the issues if you're open to receiving some feedback about your situation that you choose to share, which is why we wanted to make sure that we had some experts, and in this case, KJ, who can provide some guidance. There are other resources that we could help and point you to, but you have to be willing to recognize that you need a little assistance and you may not know everything, but you're open to at least having a discussion about how you can be more effective as a parent in co parenting so that your children won't suffer and have the same issues that you have. And we can break some of these generational trauma factors and also, generational curses and all of those things, because we always want our children to be better and to do better than we are and have been. So it starts with you as a parent. So I welcome and encourage you to join us and to be a guest on the show. Now, with that, I'll go back to
I
the
honestly feel like it'll be interested too to see if you can, or if someone that had a or have a successful co-parenting story may be willing to and show or tell their story on how or the things that they did, made their co-parenting process easy or successful as well. They work through it, navigate, yes, and we can discuss some treatments for trauma, childhood trauma. There's a number of things, a number of ways. Of course, like I said or stated before, there's no single list, there's no single method that works for everybody. If it was one way that can help everybody, everybody will be fixed, but there's no one single method. A couple of psychotherapy processes or sessions can be talk therapy, and most of the talk therapy that the therapists do will normally run about 12 sessions, and each session can be from 60 to 90 minutes long. Cognitive processing therapy is a form of CBT, cognitive behavior therapy. That's usually the first choice that individuals go to. Especially for PTSD, which focuses on the symptoms that an individual may be having. Another type of therapy is eye movement desensitization and reprocessing therapy, which helps the individual by determining and desensitizing specific targets or triggers of the life memories or negative beliefs or intense feelings that one may feel when certain topics or certain incidents happen that bring an overall symptom of trauma or depression or PTSD, to the forefront. And it kind of helps them through working through those triggers and desensitizing the feelings that comes over them when that memory, I guess, is brought back to them or when that trigger or thought, pops out. Although we repress feelings, there are certain things that cause us to overreact, and that's why those negative effects of, like, abuse or lack of communication, depression, anxiety, clinginess, or anger outbursts, occur because it's something that's triggering us in a form, and we don't necessarily know exactly what it is. And going through the therapy process help identify those symptoms, and then other treatments can help you work through desensitizing those feelings that comes with it and working through it or learning to accept it. Prolonged exposure, yeah, EMDR, eye movement desensitization and reprocessing therapy. The therapist, they'll go, like, through different, like, hand gestures, and you have to be clinically licensed and certified to do this technique because it does bring on heavy feelings or whatever, and, a little bit more physical than just talk therapy, but it has been shown to be very good for those chronic, and complex traumas. It is. Yes, it is. Some people try to dab in it, but you need to be specialized in EMDR to do it. But if you have those complex therapies, it's something that can be really useful because you're bringing an individual into that hardcore center thought process, and then you have to be able to bring them back out into a calming state. Prolonged exposure therapy, is a subtype of CBT, cognitive behavior therapy, and it mostly use talk therapy to gradually approach the memories, feelings, and actions that's regarding the trauma. So it's a little bit more subtle than EMDR, but it's also used to kind of approach those memories because a lot of times individuals are not aware, like we say, that they have those repressed feelings. So you're trying to jog their memories, bring those memories, to the forefront to match those symptoms that they're having, and it's more of a subtle way to do that than EMDR. Trauma-focused cognitive behavior therapy, is another talk therapy that's finding a connection between the behavior, and their thoughts and feeling. So, okay, this is the behavior I'm exhibiting. These are the thoughts that I'm having, and these are feelings that I'm having when I think about those memories of, the behavior that I'm acting out to kinda get the why of what I'm feeling and the why of how I'm reacting due to some type of repressed trauma or feeling, a symptom.
So after the therapist does the assessment, they will then come up with which one of these prescriptions.
Yeah, which therapeutic plan, best suit that individual. We have some lighter things such as a narrative therapy. Now, the thing about narrative therapy is for individuals that experience that complex type of trauma that I, mentioned on the first trauma session, and people who has experienced multiple incidents of trauma. But you cannot have limitations on your cognitive, your intellectual language skills when it comes to talking about the therapy I mean, the trauma itself, because with the narrative therapy, you're basically reauthoring your story. You're telling your story, your biography, but in a narrative way. So the therapist is helping you, tell your story through narration. So if you're one that can't talk about it or get locked up or hinged up or crumbled when you're thinking about that trauma, narrative therapy wouldn't be one that will work for an individual. You have to be very open and ready to talk about it. Now, art therapy is great for those who can't talk about their therapy. When words fail them, they can use creative expression to address and heal the effects of the traumatizing event through paint, through coloring, through drawings. Art therapy works for a lot of individuals. 30, 45 minutes of just sitting there, even if you're not necessarily creating art of the event itself, but eventually through being creative in that nature, your story will come to light. So art therapy is very good for those individuals that cannot talk.
We with domestic violence, they use a lot of art therapy
Yeah.
in the healing and in that
Yeah, because
process.
it's hard to talk about it, and sometimes you may be embarrassed to talk about it too. I don't know how to explain how you even got there in that situation. So sometimes working through art therapy could be therapeutic in a way of you telling your story, expressing yourself, but also unleashing some of that tension that's built up, or trapped up feelings through a form of art. Play therapy is great for children. Most therapists observe the way a child play to kind of work through making them comfortable enough to talk about the events that they may be experiencing. Play therapy or therapy is something useful for adults and kids to participate in together. One thing I think some individuals when they're going through a divorce or separation, and with co-parenting, they don't realize that therapy can be a useful tool for the family altogether. So although the parents are having an issue, it's good to seek some type of, therapy for your child. And there are things that the child and parent can partake in together to kind of alleviate some trauma from that they may not know that they have experienced over the transgression of the relationship. Trauma systems therapy is something that's great for individuals between ages of 4 to 21 years old. So trauma system therapy is a sector of trauma-focused cognitive behavior therapy, but it's great for a child and parent to kinda go through together, though it's one of those therapies. Psychodynamic therapy is another one, that's pretty much good. Family therapy, of course, is always good. It's a form of talk therapy, for individuals to sit in together and be able to talk about how one feel about the different issues, and you just have to be ready and prepared to hear everyone's perception and perspective on everything. Somatic therapy is something that's also is pretty good, and I've been seeing a lot of somatic therapy populating on social media lately. Somatic therapy is more physical, whereas you're doing, different body movements and techniques to unleash, or unhinge some trapped or pent up therapy, that's located, like, in the hip. I wanna do a little bit more study on somatic therapy, but from what I hear, just with doing somatic therapy, it unlocks a lot of, pent up trauma and stress that one may have and may not even realize that they have been holding on themselves. And I assume that, is held in the hips because that's the center core of our body. The largest muscle is in that same region of our body. So, doing somatic therapy is something that I do wanna look more into, and that's becoming more prominent and more, um, out there, and it's something that parents and children can also do. Children can also do.
Let me stop you there and ask a question.
Yes.
So, and I don't know if we had this conversation or not. But when you talk about the trauma and the impact that it has, and in particular now on the body and how it manifests and could cause damages that we don't even realize. Or what,
Irritable bowel syndrome, a lot of stomach issues. That's something that's very common amongst individuals. They don't realize, that they're having so many stomach related issues or nervousness because the nervous system is kind of out of place, like trauma really weighs heavy on the body. A lot of individuals that suffer from joint issues is a lot of trauma related or stress issue that individual don't realize, that's causing havoc or creating chronic illness.
now that you say that, I often have clients when we go to court, and they get nervous and their stomachs always hurt, right? Because of
Mhm.
all of I guess, the drama and the trauma that they're dealing with in that situation and how it impacts their bodies, and not associating that with trauma, right? It's just what happens, like, you're nervous and that's what happens. And, I get a lot of, as I reflect, and as you said that, a lot of the clients who speak about their stomachs hurting, as they sit there, and how they deal with that nervous energy, we would call it, not necessarily the trauma that it's associated with. So I don't know how that distinction would be made. Like, how do you, and I guess with studies, like, how do they connect all of this, right? Like, how do the connection get made that irritable bowel syndrome is associated with trauma and the body movement of the hips? Like, well, how does
Mhm.
that research look?
Because mental is becoming more exploratory and accepted in the world, I think more medical doctors that and kind of evaluate or do certain questions to kind of help their patients out better, just to see if they have some type of trauma and I can say I have a good set of doctors that always do a set of questions just to kind of see where my mental is every time I visit. And I feel like that plays a huge role in them diagnosing whatever my issues may be at that time.
We spoke off camera. I'm doing this training with the American Bar Association, actually, next week. And some of the pre readings that they shared, one was a video that I watched. And it was just so timely that this particular person, she was doing a TED talk, and her name is Nadine Burke Harris. And I'm going to link her video at the end of this podcast. And she spoke about the ACEs test and childhood trauma, and how she's a medical doctor, and how she reframed her thinking in terms of illnesses that children were coming to her for, and looking at it from the children dealing with trauma as opposed to just some physical illness, right? And she made that connection. And it was interesting that here we are. We understand that, trauma is important. We need to identify it as a community, as an individual, and have the conversations about it. But this work is not new work. This work has been going on for a while. And some of us are just being exposed to it. So again, our effort is to educate here. So I'll connect that particular video, and anything else that KJ has that would be, she believes, beneficial to you all. We'll connect that at the end so that you could go and do your own research and figure out what you need to do to start your journey of healing for yourself and for your child. Did you have one more? I was counting. So I think there may be one more. The last one you spoke about was the
Somatic therapy, I think that's it. Cognitive processing therapy, eye movement desensitization and reprocessing, prolonged exposure therapy, trauma focused cognitive behavior therapy, narrative therapy, art therapy, play therapy, trauma systems therapy, psychodynamic therapy, family therapy, and somatic therapy.
there are a lot of resources, a lot of expertise in those fields. And the first thing would be just make an appointment if you believe that you are a person who can benefit or have some trauma unidentified, at least have the session. I know a lot of times, resources are challenging for people, and it's so difficult, to get appointments. I don't think we fully have recovered what the structure used to look like, after the pandemic, and people were virtual and working, from their homes and not doing those office visits. There may be some options.
As our group coaching sessions, because I think it'll be very beneficial to hear or be in an environment of others that may be experiencing similarities that you have. So even if you can't get in with a therapist or a counselor, try some of those group therapy sessions and coaching sessions that you may find online. And I think that is still a great start somewhere because you get to hear other people's story and you get to hear from individuals that may be experiencing something similar to you. Because the worst thing you can do is keep everything hidden or seek a friend's advice who has never experienced or went through what you went through to seek advice from.
All right. So we did the treatment. I'm not quite sure what barriers need to overcome, if that's a separate conversation, but that's the last thing I
I
have.
mean, basically, overcoming your barriers is once you're educated about something, like I always mention, if you get a little tickle or curiosity in your heart or tummy that, ooh, letting you know, okay, this is something that I think I have, or this is a symptom that I think I experience, or this is very interesting. Let me take this test. And then you see that your numbers aren't like where they should be. Overcoming those barriers is taking the first step to identify the issue, to determine that you do have an issue, to understand that it's okay if there is something there, and to start working toward finding a way to recover from whatever the issue, the inkling, the problem, the trauma is. And can be like we stated, joining a online, group therapy session, joining a coaching session, finding group therapy event until you can get in with a counselor, social worker, psychologist, psychiatrist, to get a plan that's going for you. But educating yourself and looking and reading and finding tools or whatever to identify what may be there and being open is the number one to kinda overcome some of these barriers. If you're not open to it, if you're not open-minded to it, you're gonna stay in a cage, and those barriers will stay, in front of you. Something that we didn't really get to talk about during this is attachment styles. A lot of us have, certain attachment styles to people, communities, individuals that we probably shouldn't have got into certain situations or relationships with, from the beginning, but not treating therapy or repressed trauma or not going to therapy, should I say, or not treating traumas, has put us in relationships or situations that we probably shouldn't have been in or stayed in as long as we have stayed in, and we have developed certain attachment and developed certain styles has that added on to our trauma and added more to our plate and added more, controversy and drama to our lives.
You said it, and I was like, okay, so attachment style and not choosing. And if you could define what it means to attach, and at the same time, I equate it to, in listening to you,
Mhm,
you're choosing the wrong partner. You know how you stay in these cycles and
mhm,
you
mhm.
you you pick the wrong partner, and I don't know if that's because of attachment style, and you can explain that. And you get out of that relationship and you get in another relationship with the same type of person that you realize that that didn't work, but you don't equate it to an attachment style. I don't know what you equate it to, because you just end up in this cycle of choosing a partner who the relationship doesn't work. It doesn't go where you want it to go. It doesn't end the way you want it to end. And you keep repeating the same.
Managing it because we are, yeah. They have 4 different attachment styles. Secure attachment, I mean, that kinda grows from, like, infancy, you know who your primary caregiver is and who's gonna provide you that comfort or understanding or that safety. So you stay in a secure environment because you think you feel less lonely by staying in that environment. So you develop this attachment, because of the feeling of security. Then you have anxious attachment, and it kind of develops from childhood when you often feel worried or insecure or experience worried or insecure patterns or interacting after getting like inconsistent care from your primary caregiver. So as soon as you find someone that comes across as clingy or spending too much time or energy worrying about their relationships, you start to get nervous and develop this anxious attachment because you don't want them to go because you are used to, things overly changing or whatever from childhood, if that makes sense. Avoidant attachment is another one. Children with avoidant attachment has learned that their primary caregiver can't meet their needs or reliability. Basically, they depend on themselves, and they have learned to be so independent and had to kinda raise themselves, so they become so independent, and as adults with avoidant attachment styles, they don't care about their relationships. They just like depending on others. They don't want others to depend on them. They may struggle to be vulnerable or intimate with relationships, which can often lead to, less satisfaction, or less connection or general lack of support. So they have this avoidant attachment style because they essentially was abandoned kinda from their childhood. And then a fourth one is disorganized attachment, which, researchers noticed that some children respond to reunions with their caregivers in unpredictable ways that combines, elements of anxious and avoidant attachment. So some kids, they acted as though they wanted to punish their caregivers for abandoning them, while others seemed fearful or conflicted. Some even took on to the caregiver's role themselves, to try to comfort their parent. So, as children grow up with disorganized attachment, they struggle with hostile or oppositional behavior. So, adults, they find relationships to be confusing, scary, unpredictable. While they may crave intimacy, they are not confident in their partners will return the effort. So, they're basically in a disorganized attachment style.
And, that's a lot. I was trying to take some notes. That's a lot. And, I'll go back to what my practice does and what I typically see, based upon my clientele. When we talk about this avoiding attachment, that covers, so much. I'll speak about, I guess I'll say it as the independent woman, right?
Yeah. Yes.
Whether or not she would be, with that avoiding, and not to generalize, but just to start a conversation, they depend on
Oh,
themselves.
wow.
Yeah. And all of that stems from some exposure to things that happened in your childhood.
Primary caregiver couldn't meet their needs. They had to rely on themselves instead for a lot of things. So they learn to be independent at an early stage.
And I get so much of that when we're trying to they want to enter into an agreement of compromise, right, and setting up a structure for co-parenting, but they were raised by single women, right? Their mom and the mom did it. So they can do it and they don't need this man to do it. He can do it if he chooses to, but they don't need him uh to do it. And that superwoman, that avoidance, I didn't equate it to avoiding or avoidance attachment, or trauma at all, which is why you're here.
And attachment style, yeah, from childhood trauma.
Yeah. So that I meant, KJ, you have shared so much with us, and it's a lot of information to dissect and to understand that we And that there may be some professionals out there that are listening to this, but for me, you know, like I said, I can just look at things and say, "Oh, that's an issue." I can't tell you that it's avoidance or deorganized or, anxious. I just know that there are professionals who can help. And my hope is that this series will allow us as individuals and as parents to decide that we're going to do something different, because at the end of the day, we don't want our children to go through the same hurdles that we went through, that we're still struggling with. And if there's any action that we can take to make it better for them, that they don't have to deal with as many traumas as we had to deal with as we grew up and as we continue to recognize and to have treated, that's all we could do. But do something different, so that your children get the benefit again of both parents. And if you're here at this, if you recognize yourself with this avoidance attachment, reach out. KJ is, we have to end the series. We would speak to her forever if we can, but she has some studies that she needs to complete so that the next time we see her, we can properly address her as Dr. Franklin. So if you want to share any more about your path and where you're going and what your hope is for this series and to do in the future, please do, KJ, at this time.
Again, I'm a doctor.
And we look forward to your publications and your impact that you will have on this community, and being so willing in this moment to share with us, and invite you back anytime you want to come and be a guest or to share with the audience at Co-Parent Court. We hope you will continue to find that we are open to having you here anytime you want to. And again, with that, I thank you for taking so many hours to share with us and to help educate us about the traumas in our lives. And with that, we are hopeful that we will take advantage of your expertise and your suggestions, and that we will find ourselves in a better situation, that we, those of us who are seeking to co-parent, will not do it solo, but to do it in a more effective co-parenting way. And with that, until next time, this is Judge Rochelle Jackson. And our hope is that you